Welcome to the beginning of your Invisalign journey. We've sent you home with a lot of stuff after today's appointment, including our oral hygiene kit. In here you have everything you need to maintain good oral hygiene throughout your Invisalign journey. You'll also notice that there's an Invisalign starter kit. Inside this bag, there's a box. Inside that, there's an educational pamphlet on Invisalign and a case where your trays will be stored when they're not in your mouth, during eating, drinking, and brushing your teeth. Removing your trays can actually be a little bit of a learning curve. Take your finger to the opposite side of your mouth, to the very last tooth at the back. Pull down and then roll the tray out towards your cheek and off the other side. If you're having trouble, you can use an instrument like a hook that we can provide you if you need help to pull down from the inside and then use your fingers to roll off the rest of the way. The great thing about Invisalign treatment is that you can continue to eat your favorite foods. You will notice, however, that the first few days, especially with the first tray, will be tender. Let your tooth's tenderness dictate when you can resume a normal harder food diet. If you're finding this transition period especially painful, feel free to use over-the-counter pain medication like Tylenol or Advil following the recommended dosages. We do recommend you remove your trays for all eating and drinking, except for water, to reduce the risk of trays staining or cavities forming. Changing your trays is very important to continue seeing progress in your treatment plan. We recommend setting a reminder or marking your calendar so that the same day every week you change from your old set of trays to your new set. Place your old trays back in their bag and find the next number in the series. If for any reason you have not been able to wear your tray for the appropriate amount of time, please stay in the previous tray longer until you feel that it is fully tracked. Another amazing benefit of Invisalign is that you can continue your great oral hygiene habits, brushing and flossing like normally. To clean your trays, just run your trays under warm water and take your toothbrush and scrub all along the inner surfaces. You can also scrub the outer surfaces as well. Rinse and shake them off. Toothpaste is not necessary. If you've had to be in a tray for a longer period of time and are noticing that they are getting grungy, you have been supplied with several packages of cleaning crystals. Simply use warm water to dilute the crystals, mix and stir, and allow your aligners to soak for several minutes. If you run out of these packages, there are over-the-counter products like Polydent Retainer Cleaner that can be used similarly. Or you can try a do-it-yourself baking soda slurry by simply taking some baking soda, mixing with a little bit of water to create a thick paste that you can then brush over your aligners to remove any stains or residual debris. Another helpful tool we'll talk about is called a chewy. What we're looking for with our trays are well tracking and seated trays. The upper teeth here are fitting perfectly. The lower teeth aren't filling the tray as well. And what that means is the teeth are not moving perfectly. These chewies can be used to help seat the aligners more fully and allow the movements to track as planned. Chewies can be used with a new tray by simply biting and walking the chewy along your teeth. Next, we're going to review what to do for certain situations that may arise. If you have a tray that is bouncing at the back, simply remove your tray, take your fingers, squeeze the back area that feels bouncy, and bend it towards your chewing surfaces. This allows the tray to grab more of your teeth. If you feel that an attachment has come loose off of one of your teeth, continue to wear your trays like normal and call us so we can schedule a repair. If a tray breaks or is lost, simply move ahead to the next tray. Add on the days that you should have been wearing the tray before to the new tray. More information on your Invisalign journey can be found on our website by looking under Invisalign Frequently Asked Questions. Here you will find tons of information that patients have asked us. Will it affect my speech? Is there any discomfort? Can I chew gum? And what do I do if there's a sharp edge? We do recommend that if there is any sharpness, you take a clean, sterile nail file and smooth the edge at a 45-degree angle. We also have in here your path to success, which you will have received at your first appointment. Our goal is to make this process as easy and smooth as possible, and we look forward to seeing the changes in your smile at your next appointment.